Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about overview HIV. HIV, which is called human immunodeficiency virus, is a virus that damages the cells in your immune system and weakens your ability to fight everyday infections and disease. AIDS, which is called acquired immune deficiency syndrome, is the name used to describe a number of potentially life-threatening infections and illness that, that happen when your immune system has been severely damaged by the HIV virus. While AIDS cannot be transmitted from one person to another, the HIV virus can. There is currently no cure for HIV, but there are very effective drug treatments that enable most people with the virus to live a long and healthy life. With an early diagnosis and effective treatments, most people with HIV will not develop any AIDS-related illnesses and will live a near normal lifespan. Symptoms of HIV infection: most people experience a short flu-like illness 2 to 6 weeks after HIV infection, which lasts for a week or two. After these symptoms disappear, HIV may not cause any symptoms for many years, although the virus continues to damage your immune system. This means many people with HIV do not know they are infected. Anyone who thinks they could have HIV should get tested. Some people are advised to have regular tests as they are at particularly high risk. Causes of HIV infection: HIV is found in the body fluids of an infected person. This includes semen, vaginal and anal fluids, blood, and breast milk. It is a fragile virus and does not survive outside the body for long. HIV cannot be transmitted through sweat, urine, or saliva. The most common way of getting HIV in the United Kingdom is through having anal or vaginal sex without condom. Other ways of getting HIV include sharing needles, syringes, or other injecting equipment, transmission from mother to baby during pregnancy, birth, or breastfeeding. The chance of getting HIV through oral sex is very low and will be dependent on many things, such as whether you receive or give oral sex and the oral hygiene of the person giving the oral sex. If you received blood transfusion before 1996 or blood products before 1996, there is a chance you may have been infected with HIV. If you have contracted HIV from infected blood, help and support is available. So, how to diagnose HIV? Seek medical advice as soon as possible if you think you might have been exposed to HIV. You can get tested in a number of places, including at general practitioner surgery, sexual health clinics, and clinics run by charities. The only way to find out if you have HIV is to have an HIV test. This involves testing a sample of your blood or saliva for signs of the infection. It is important to be aware that emergency anti-HIV medicines called post-exposure prophylaxis may stop you becoming infected if started within 72 hours of possible exposure to the virus. It is recommended that you start it as soon as possible, ideally within 24 hours. An early diagnosis means you can start treatment sooner, which can improve your chances of controlling the virus, reduce the risk of becoming more unwell, and reduce the chance of passing the virus on to others. Both positive and negative HIV tests may need to be repeated 1 to 3 months after potential exposure to HIV infection. This is known as the window period, but you should not wait this long to seek help. Clinics may offer a finger prick blood test, which can give you a result in minutes, but it may take up to few days to get the results of a more detailed HIV test. Home testing or home sampling kits are available to buy online or from pharmacies, depending on the type of test you use. Your result will be available in a few minutes or a few days. If your first test suggests you have HIV, further blood tests will need to be carried out to confirm the result. If this is positive, you will be referred to specialist HIV clinic for some more tests and a discussion about your treatment options. So, as regards the treatment of HIV, antiretroviral medicines are used to treat HIV. They work by stopping the virus replicating in the body, allowing the immune system to repair itself and preventing further damage. This comes in the form of tablets which need to be taken every day. HIV is able to develop resistance to a single HIV medicine very easily, but taking a combination of different medicines makes this much less likely. Thank you very much.